Morning, everyone. Thanks for hanging out, and looks like we can begin. Just had a few problems with I guess, technology, so which is good actually because it gave me time to just sit. Losing an hour of sleep for me is no fun. I'm not a morning person. So anyway, I try. I force myself, and it's getting easier, but it's not me. So anyway, today we're going to talk about Ayurvedic assessment, Darsanam and Sparshanam, and we are going to, there are 11 pages, so I'm going to try to move through this quickly. Last time I rambled. I tend to do that. Before I start, a quick prayer to Lord Ganesh. Shri Ganeshaya Namaha, Om Gam Ganapate Namaha, Vakradunda Mahakaya Surya Koti Samaprabha, Nirvignam Kurume Deva Sarvakaryeshu Sarvada. Om Ayin Saraswati Swaha. Klim Krishnaya Namaha, Ram Ramaya Namaha, Dum Durgaya Namaha. All right. So today is going to be a quick overview on Darshanam and Sparshanam and also Marma. Just kind of a bird's eye view of the general concept of Marma. That topic of Marma will be delved into later, especially workshops and things like that. It's something that you really have to learn in person. And Kirti ji, Monica ji are fantastic teachers. And when you're in their presence, when you're in the presence of the Guru, physically it makes a big difference learning these things. So I'm just going to touch on it and not dive in too deeply. So Darshanam means to see, and it comes from the root word drish or drik, which means to see or sight. And it is an observation made using our sense organs, our human organs. Sight, intuition even can be used to deduce, gut feeling even to deduce clinically what's happening with the patient. So we see something in our, in the patient's body or their body language or in their physical exam, and we come up with something called a differential diagnosis. What could it be? It could be this, that, or the other. And as we talk to them and as we examine them, whether as a physician using labs or technology or as an Ayurvedic practitioner using the different Pariksha Vidhi, we narrow down our diagnosis into what it could and couldn't be. And that's part of making our clinical assessment of the patient. So we use Darshanam for determining the level of Mahabhuta and Guna dominance physically, and we also formulate a diagnosis based on their mental and spiritual presentation as well. Now, when I use the word diagnosis, technically, legally, if you're not a physician, you can't use the word diagnosis, but you all understand what I'm saying. Basically, what's going on, what do I need to do? That's what I mean. Using our senses to direct perception and the 4 observation techniques for the face, general appearance, vata, pitta, kapha, nail, sound of voice, and so on. These are the bits of data that we pick up when we encounter a client. Pretty straightforward. So Darshanam, these are things that seem obvious, but it's actually funny how it takes time and practice to get to know this. I mean, in a book you can read about it and go, well, obviously, how a person looks and talks and all that. Well, that sounds easy, but then there are a lot of gray areas when you meet a person. Well, they said that their skin is oily on some days and not on others, and sometimes in the mornings they have bowel movements that are banana-shaped and cohesive, but then they have diarrhea in the evenings. I mean, no one really, if you think about it, your body doesn't read the textbook, as I always say in medical school. So every time you talk to someone, you'll find that their history is not, that they give you, is not exactly what you've read about in the textbook. It's not so clear-cut. And so part of the art of medicine or Ayurveda is to take that book knowledge and synthesize it into real life practice, and that takes time. So in the beginning, it's really frustrating, I know, and I've been reading some things in the forum where what if someone has wavy, thick hair but it's oily and it's coarse, but it, these are things that will take time to sort out, and also as we go on into block 2, they'll make more sense too. So Sherlock Holmes, exactly. How a person smells. So, do they have a no body odor? Do they have a sharp pitta body odor? Sometimes, you'll be with a patient, and I'll talk about it from my clinical point of view sometimes. I think that the examples stick. Sometimes you're with a patient and you can't figure out what's going on, and the room you walk in and they smell, but they look fine to you, but then you turn them over and they have bed sores. Might have a gangrenous foot. These things smell, or they might have foul vaginal discharge that you can smell in the air when you walk in, or they might have tonsillar stones, so you can smell the volatile sulfuric compounds when you walk in. They may be on a low-carb diet like the Atkins, or they may be in a state of diabetic ketosis. When you walk in, they have a fruity breath, an acetone-like breath, and that, their body is giving off. So you can sometimes, when I'm working in an emergency room or an urgent care setting, I have smelled that fruity, characteristic odor of diabetic ketoacidosis. And you can go into that room and smell that and go, okay, they're in DKA. That's one of the hints. So that's just even the smell of the feet, the smell of the scalp, the body odor. These are things that you can pick up on when you're with the patient in close quarters, and you can guess their prakriti, vikruti, and their general constitution based on smell. How a person walks, there are different types of gaits, pathological gaits like those that you see in Parkinson's disease, or certain types of paralysis or hemiparalysis, rather, or just, are they in pain? Or even when they walk, what is their self-esteem? What kind of confidence do they radiate? Do they seem like they're kind of down? Do they radiate this low self-esteem, or do they walk proud with their shoulders back and chest out, kind of with this presence? What are their shoulders looking like? Are they stooping? Are they drooping? So these are things that we pick up on. And sometimes it's settled. Sometimes the patient is nonverbal, or the patient doesn't open up to you right away, and you look at them and you look at their stance and their affect, their face, their expressions, and you kind of say, well, today you seem a little down, and you kind of start the conversation like that, and then they start opening up to you. Yeah, doc, actually, this is going on. But sometimes at first they're not really willing to tell you what's going on, and you have to fish it out of them. Do they have, we touched upon this, dry hair, oily skin? Are their eyes droopy or clear or bright? Is there a tinge of yellow to the sclera? Do they have a touch of jaundice? Are their eyes red? Is there an infection going on? Is there fever? What are the pupils doing? The pupils do different things in different disease states. For example, syphilis, you can see manifestations, or just, drugs. Are they on drugs? What are their pupils doing when they're on different medications? And then also Ayurvedically, what's the shape of their eyes? Do their eyes look dry? Do their eyes look? Is the drishti, is the way they look around? Is it kind of twitchy? Do they have these shifty eyes? Are their eyes expressive? Eyes really are the window to the soul. So, are they bright and clear? Or does it seem like they're hiding something, or they're suspicious of you? And we'll talk about all of this. But it's very interesting reading the face and reading people. And all of us as human beings instinctively know how to do this. It's a matter of trusting those instincts when we're face-to-face with a client. Also, sometimes, osteopathically, I'm an osteopathic doctor. Sometimes we look at the eyes if they're droopy because we can tell certain skull growth patterns, maladaptive patterns For example, we look for something called the melting face. So if there is space between the eye, the iris, white space underneath, we can predict that their face is going to be long growth. The maxilla is going to grow downward, and usually we can say, okay, this person probably, is a mouth breather or sleeps with their mouth open. And this maladaptive process of not having the tongue up to the palate and creating space will cause malocclusions of the dentition and cause further complications in the way the face grows. So that's one thing we look at as well. What a person looks like, their skin color, is it red? Tells us their emotional state. Are they flushed or blushing? Again, are they jaundiced? Do they have some sort of infection? Do they have an area that's red that indicates some sort of localized infection like cellulitis, or do they have streaks, leading from that infection up towards the heart, which would be, where that infection is spreading into the lymphatics? What are they fair? Are they tan? Are they freckled? Do they have moles? All of these hints give us an idea of their prakriti and their vikruti as well. Is it wrinkled? Is it oily? Is it tight? Is it loose? Does it look radiant or does it look dull? Similarly, what a person is wearing, what kind of clothing do they have that gives us a little bit of an idea of maybe their socioeconomic background, maybe, not always, about their choices of color, their moods, their self-regard. All these things is part of darshanam. And how they're talking. Do they speak fast? Do they speak without thinking? Are they impulsive with their speech? Or are they deliberate and slow? Are they analytical? Are they harsh? Are they cutting or accusatory? Or are they, is their speech pleasing? Is it, all these things. Again, review for us. We know these things, but it's just fun to think about. Exactly, shabda. Sometimes you have to really, really listen in. I had a patient years ago who, she was very put together. She was very cheerful, and she was talking about her life, and, really you wouldn't have known how sad it was. She kept referring to her husband, saying, oh, he's fantastic, and it was a little over the top, and it was a little suspicious. And I opened the door, and he was hovering outside, and he wasn't in the exam room, but he was there, and he appeared to be very doting. And I had him in, I brought him in, and I talked to him, and I said, it's so nice to meet you. I've heard so many wonderful things, and I'm going to be a little while with the patient, so would you mind waiting outside in the waiting room? And, I kind of befriended him and got his trust and had him step away from the door. And when he left, the patient broke down and started crying, saying, he's been beating me, he's been threatening to kill me. When she felt that he was away, he was hovering to show that he was a supportive spouse, but the way she was talking about him, even though it was positive, was a little off. So sometimes when patients aren't saying things, you read between the lines, and we've all done this. I'm not mentioning this story as if it's like some sort of amazing thing I did, but all of us have come to these conclusions in our observations in the past. Sparshanam includes Nadi Pariksha, and I think this might be a spell check thing. That should say palpation, not oh, that is correct, palpation. This should say auscultation, not oscillation. Let me see if I can fix that. Here we go. Text. Here. Okay. And auscultation. Oh. Here we go. Can you see that? Sometimes spell check will do this. where you want to put in something. Oh, do I have to click on it? There. Is that better? Where it will correct things for you when you don't want it to correct things for you. So we are going to talk about Nadi Pariksha, which is feeling the pulse. What we do when we feel the body physically, which is palpation. Auscultation, which is listening using our stethoscope or our ear, and percussion. And now just a quick word about when you read English versus Sanskrit, this word N-A-D-I is pronounced nadi in this context, nadi pariksha, which is the pulse. Without diacritical marks, when you write things out, if I didn't know that by context, it could also be read as nadi, which means a river. So nadi and nadi are different, completely different sounding words. So just be aware sometimes when you read the English version of Sanskrit, the pronunciation could be wrong. So sparshanam involves the checking the thickness of the skin, the energy levels, and the tightness of the marmas, the temperature, palpation, not palpitation, because palpitation is like a heartbeat that you feel. And I think that's also thanks to spell check. Let me see if I can get that fixed. Oh, I'm not very good at this text tool here. Up here, palpation. It was right in the first little paragraph. So this may depend again on one's licensing, like I've just briefly touched upon a few minutes ago. State laws. For example, Vaidya or physician can do all of the above. Massage therapist can palpate muscular stiffness. And if someone doesn't have a license, then they can't use certain tools, such as maybe using the stethoscope. I don't know. It does that. There is no medical spell check. I know. It's frustrating. That's okay. We'll figure it out as we go along. So, so we're doing prashna. So we're asking prashna. Prashna means questions question in Sanskrit. So when we ask questions, we're asking relevant and intelligent questions through a form. We can do that. That's one option. So using the forms that we've been doing is a great way to ask questions. I have my patients fill out a form, a Vata, Pitta, Kapha, Prakriti, and Vikriti form. It gives them an awareness of, oh my goodness, she's asking about my bowel movements. No one's ever asked me about that. No one's asked me about my hair or my periods or my weight fluctuations. So it kind of helps them, it helps sort of break the ice when you first meet someone and gives them an idea of what you're looking at. And while they're filling out the form, a lot of times I'm looking at them or I'm evaluating them and making my own assessment. And sometimes I have them fill the form in the middle of the meeting or sometimes in the beginning, but I don't rely solely on the form. So like Monica G always said, the form is a great tool. It's not the full deal. And a lot of patients will say, well, I filled out an online form and you're saying my prakriti is this, but according to the form online, it says my prakriti is that. And I tell them, well, it's not a complete assessment. Once you come in and you filled out the form, you're not necessarily objective when it comes to filling out your own information. Secondly, I haven't examined you. So you have to tell patients that the form is not the be-all, end-all of the assessment. And that's the whole art of Ayurveda, right? We're talking about all these different things. Exactly. So, but there is an art to doing that. There's an art to getting that information. Okay. I'm going to try to finish by 8:15. Let's see if I can do it. So marmas would come under the sparshanam assessment. Sparshanam means to touch. And marma is derived from the Sanskrit word mri or mru, which means which means death. So if these Marmas are not respected. If they're struck, it could lead to death. There are different interpretations of this word. Some sources say it means a hidden point or a secret point. Anyway, Mariyanti iti marmani means injury to certain points on the body causes severe pain and can be fatal. There are 107 in number, and the Manas is considered the 108th Marma by some. So what is a Marma? What physically is a Marma? It's a spot on the body where two or more types of tissues meet, such as muscles, veins, ligaments, bones, and joints. And their sizes can vary. Sometimes they're just a finger, just one finger in size, one anguli matra, or sometimes they're the size of the palm. They can be large. And most of them are situated on the surface of the body, but some are situated deeper and are related to internal organs such as the heart or the bladder and the like. And they're all over the body, but the head region has a large number of marmas. If you look at a map, a marma map, you'll see that the head has a pretty high concentration. So again, this is a lot of detail, and this will be covered later by our teachers, but just an overview. In Ayurveda, 12 pranas are mentioned, and these are the Agni, Soma, Vayu, Sattva, Raja, Tama, Pancha Indriya, and the Bhutatma. So of these 12 pranas, Agni, Soma, and Vayu are located in the regions, at the regions of the Marmas. So they are vital points of the body, because marmas are, but it's so hard to articulate for me sometimes, but they are sort of the way you can access these nadis of the body, right? And the way they're infused with prana, and they're infused with, especially, they're tightly related to Majja Dhatu and to Vayu, because Vayu or prana or vata carries these nervous impulses. So anyway, so naturally Agni and Soma and Vayu are going to be located and concentrated at these regions, and hence they're vital. These points exhibit concentrated vital energy force, and they are closely related to the nadis and chakras, which I just mentioned. Just a quick word. I'm sorry, I just have to say this. I just really, really have to say this, and I can't stop myself. This word, too thick a line. Please, 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 please do not pronounce it as chakras. It isn't. There's no such word. It's cha with an actual hard ch sound. Chakra. Chakra means wheel. If you can't say chakra with an Indian accent, call it chakra. But and I know this sounds obnoxious, but there's no such word as chakra, and that's the kind of what we hear in the West here. And I'm sorry, when someone says chakra, it's like nailed down a chalkboard. I have to call them out on it. I don't know why. It just bothers me. All right, thanks for listening. So the Marma Cikitsa helps awaken the mind for really. Is having a seizure. Marma Cikitsa helps awaken the mind for directing it toward the spiritual path and the ultimate goal of life. All right? Sorry, sometimes I'm obnoxious, I know. I will stop people mid-sentence and just gently correct them, because I can't help it. All right. Some examples. So the toes are the big toes. We have a point called the Kshipra Marma. And then, these are I'm just going to mention some of them here. The ankles, we have about 4.5 finger units, anguli matra. Matra is measurement. The word matra comes, the word meter or metric comes from matra. So anguli matra meaning 4.5 finger measurements or units from the toes going upwards proximally. You have the gulfa ankle marma. And I believe that there is, if I remember, lateral and medial ankle point. I need to double check that. So one on the inside of the ankle, one on the outside of the ankle. But I think Dr. Kirti could comment on that, or even Dr. Monica at some point. And then you have the center of the heart. So from the navel to the middle of the heart is about 14 finger units. And then you have the Hridaya Marma, and the base of the throat. 6 finger units from the middle of the heart is Nila Marma. Just some examples. So let's talk about classification of marmas. The distribution of marma points according to location. So you have marmas which are classified in this way, where they're located. So you have 22 in the lower extremities, 22 in the upper extremities, 12 in the chest and stomach, 14 in the back, and 37 in the head and neck, where we said that they're really concentrated. So this is one way Sushruta divided the marmas. And it's interesting when you read about Sushruta and how these marma points were related to surgery and how certain points healed faster or healed slowly with respect to where you incised the person. So he gave them a lot of importance. And then you're going to classify, another way of classifying marma that he did was according to the physical structure. So you have mamsa marma in the muscle, the marmas in the blood vessels that convey bodily fluids and impulses. That's one group. Then you have the snayu. Snayu, the word sinew, is related to the text. I don't see my cursor. Let me see. It's not letting me. Whatever. Okay. I can't get it to type. Sinew, S-I-N-E-W, that we use in the English language comes from snayu. So these are the tendons, the osti, that we are familiar with that term, osteopathic or osteoporosis. Those are the osti, the bones. So you have points in the bones, and then you have sandhi, which are the joints, articulate points, and those are 20 points. So again, oh, here we go. That worked. It's tiny here. So you have 107 points total. Let's talk about the marmas and the mahabhutas. So the marmas in the region from the feet belong to the earth element, which makes sense, right? So, for example, tala hridaya on the feet. There are marmas in the region from the knees to the anus belonging to the water element. The key marma is the urvi marma in the middle of the thighs. And then you have marmas in the region from the anus to the heart belonging to the fire element. For example, nabhi, navel, marma on the navel. And then think about marmas from the head, from the heart to the middle of the eyebrows, belonging to the air element. So there's, for example, a point on the nostrils as well. So think about marmas based on the mahabhutas. So we talked about marmas based on the location in the body and physical structure. This is another way that they are classified, is relating them to the mahabhutas, or the 5 great elements. And then you have marmas in the region from the middle of the brows to the top of the head belonging to the ether element. And, for example, the adhipati marma on the head, or also murdhni, also known as murdhni marma. Very interesting, Monica Ji, your point. Pendulum as well as touch to assess marma imbalance. So really interesting. And we have just a couple more minutes, so let me finish up with the last slide. Mantra is not only used for spiritual purposes, but has a wide application for healing purposes. Marma Cikitsa is widely used in all aspects of Ayurveda. It has a special application to energize and protect marma points, and can create a protective covering or armor. Kavacha is an armor. Also facilitates the flow of prana through the marma, which can be directed by our energy of attention. And many mantras can be used. I just want to talk about mantras really quickly. I grew up, there are many, many kavachas. There's a Shiva kavach, there's a Sita kavach, there's a Hanuman kavach. There is a, kavach basically means an armor. And in Sanskrit, there are certain Sanskrit verses that you sing, shlokas, that are grouped together called kavachas, and they're in honor or praising that particular deity. And in return, we ask for protection, their protection. The one that I have memorized as a kid, a lot of people do different ones in their family, was the Rama Raksha. And for me, that is my personal kavach that I say, I aim for saying it every day. But in the Rama Raksha, you name off each part of the body, and you ask Ram to protect that part of the body. So sometimes when I'm with a patient, I'm in session with them, I will sing shlokas from the Rama Raksha. And as I'm singing the corresponding shlok to the part of the body, I will touch that marma. So, for example, there's a shlok that says, Shiro mera gavah patu. Shira means head. Bhalan dashrathatmajaha, protect my forehead. Kausalyayo drisho patu, protect my drisha, my eyes. Vishwamitra priyashruti, protect my ears. Granam patu makhatrata, my nose. Bukham saumitri vatsaraha. Anyway, it goes on and on. It names every part of the body, your teeth, your tongue, your neck, and all the way down to the feet, to the tips of the toes. And at the end, it says, Patu Ramo Akhilam Vapuhu, protect me, Ram, protect me from head to toe. So it is a fantastic kavacha. There's one for Sita, which is similar. There's a million of them. This is the one that's dear to me because I grew up with it. But many mantras, I would love to share it with you. I just don't know how much time we have and who's up after me. Maybe I could send a link or something. Yeah, I'll post it. And what else was I going to say with Ram Raksha or just Kavacha? The attention also, throughout that shlok, there's one beautiful shlok in the Ram Raksha that says, Vajra Panjara Namedam Yo Rama Kavacham Smaret Avyahataadnya Sarvatra Labhate Jaya Mangalam. So Vajra is diamond. It's not really quite diamond, but Vajra Panjara is one who sings this Rama Raksha. Usually at the end of every group of these hymns is a section called Palashruti, meaning it tells the person who's singing it, when you sing these shlokas, you'll get X, Y, and Z benefit. So it appeals to our selfish human nature of, okay, well, I'm singing this Rama Raksha. What am I getting in return? It's more spiritual than that, but that's a very superficial meaning. But it also gives you a lot of strength that when I'm singing this kavach, this is what's going to happen. This is what I'm doing it for. It's an incentive. The incentive is to always remember the divine, but sometimes we need something tangible and human, that if I sing this, I'm going to be healthy and happy. Anyway, the last shlok, one of the shloks towards the end is Vajra Panjara Namedam. Singing this Ram Raksha set of shlokas gives you a diamond cage around your body. Vajra Panjara Namedam Yo Rama Kavacham Smaret. Whoever thinks of Rama and recites these shlokas will be blessed with a diamond cage around their body. Avyahataadnya Sarvatra Labhate Jaya Mangalam. And whatever that person does will be blessed with auspiciousness and victory. And again, it's so important to have these visualizations because these are the positive affirmations that we give ourselves. This is positive thinking. So when we do Rama Raksha, and when I imagine that diamond cage, like this force field around my body, imagine the healing that's happening. Even if I don't believe in Ram as a deity or whatever, just that positive feeling of being protected is such a great visualization. And how, imagine the surge of positive neurotransmitters and chemicals and the sense of well-being that it's infusing throughout my body. So anyway, I've gone over by 3 minutes, and I just wanted to stop, but maybe I'll post the Ram Raksha on the forum. It's very dear to me, and I think it saved my life several times. All right, I think I'll stop. Thanks for listening, and